Hey everyone, and welcome. Today, we are diving into something that's probably confused just about all of us at some point, the medical bill. We're going to peel back all those confusing layers and really demystify the true cost behind all the numbers you see on that page. Let's get right into it. Seriously, have you? Because if you've ever stared at that page of codes and felt like you were trying to read another language, you are definitely not alone. But what if I told you that the big number at the bottom, the price, isn't the whole story? In the world of economics, it's not even the most important number. Okay, so this right here is the single most important thing to get your head around, the difference between price and cost. The price, as you can see, is what you or your insurance company gets charged. It's the sticker price. But the cost, well, the cost is the actual value of all the resources that were used to take care of you. The doctor's time, the fancy equipment, the medicine itself. And here's the kicker. In healthcare, those two numbers are almost never the same. So if the cost isn't the price, what is it really? To figure this out, we've got to start thinking like an economist. We need to look at what was given up in order to provide that care. And that brings us to this big idea, opportunity cost. It sounds complicated, but it's actually pretty simple. It's just the value of whatever you had to give up. So if a nurse is in your room, that's time they can't be helping another patient, right? That's an opportunity cost. Our source material has a great example. Think about volunteers who staff a clinic. They're not getting paid, so there's no price, but their time is an incredibly valuable resource. That time, which they could have spent doing literally anything else, is the opportunity cost. It's a very real part of the whole economic equation. Now, here's where it gets really interesting. Cost isn't some fixed static thing. It actually changes over time. I mean, a dollar back in 2005 is not the same as a dollar today, right? So to make any kind of fair comparison, economists have to adjust for this. And they have two main tools to get everything on a level playing field. First, there's standardization. This is all about adjusting for inflation, bringing those costs from the past into today's dollars. And second, there's discounting, which kind of does the opposite for the future. You see, a dollar in your hand today is worth more than a dollar someone promises you a year from now. So discounting brings those future costs back to what they're worth in the present day. Okay, so we figured out what cost is, and we've adjusted it for time. Now what? How do we use all this to make actual real-world decisions, like, say, choosing between two different medical treatments? Well, we do it with a tool called the incremental cost-effectiveness ratio. Yeah, I know, it's a mouthful. They call it ICER for short. But the idea behind it is actually pretty simple. It helps us answer one single question. What is the extra cost we have to pay to get an extra benefit? So instead of just looking at the total cost of two treatments, we're comparing the difference in their cost to the difference in how well they work. Let's make this real with an example from our source. Let's say a new treatment costs an extra $12,500 for a group of patients, but it also leads to 4 more successful outcomes. The ICER calculation boils all that down to this single number. The cost for each additional success is $3,125. That's the number a decision maker is looking at when they have to ask that tough question. Is that extra benefit really worth that extra cost? All right, now that we've got the framework down, let's put on our detective hats. We're going to go investigate how the costs for specific things on a bill, like drugs and hospital stays, are actually figured out. First up, medications. You might see a charge on your bill based on something called the average wholesale price, or AWP. The easiest way to think about this is like the sticker price on a brand new car. It's an official list price, sure, but it's almost never what big buyers like hospitals or insurance companies actually end up paying. So to get closer to the real cost, economists have to look at other numbers. The wholesale acquisition cost, or WAC, is a step closer. That's kind of like a catalog price. But the most precise number, the one that gets closest to the truth, is the average manufacturer's price, or AMP, because it actually includes all those secret discounts. But here's the catch. As you can see, that number is proprietary. It's a secret. It's a perfect example of just how tricky finding the true cost can really be. Now, for the big one, how much does a hospital stay cost? Well, as this slide shows, there are 4 main ways to estimate this, and each one gets a little more precise. Just think of it like climbing a ladder. We start at the bottom with these really broad estimates, and we climb our way up to a super detailed item-by-item breakdown at the very top. And this right here just brilliantly shows why that precision matters so much. If you use the simplest per diem method at the bottom of the ladder, a 3-day hospital stay costs $6,000. Doesn't matter if it's for appendicitis or major heart surgery, which, is obviously nuts. But look what happens when you use a more precise disease-specific rate. The costs suddenly look totally different. $4,500 for one and a whopping $30,000 for the other. This shows you just how critical it is to use the right method to get an accurate picture. Okay. So far, we've really been focused on the costs that you might see on a bill. But to truly understand the full economic impact of an illness, we have to zoom way, way out. First, you've got your direct medical costs. These are the obvious ones we've been talking about, right? The medications, the visits to the doctor, the hospital bill. They're the easiest things to see and to count up. But then there are direct non-medical costs. Now, these are the costs you have to pay just to get your treatment, but they aren't actually medical things. We're talking about gas money to get to the hospital, paying for a babysitter while you're at your appointment, or even getting a hotel room if you have to travel far away for special care. Then we have indirect costs, and this one is huge. This is all about the value of lost productivity when someone is just too sick to work. This doesn't just hurt the individual's wallet, it's a cost that affects society as a whole. And finally, and this might be the most important one of all, we have intangible costs. These are the hardest to put a number on, but they are incredibly real. We're talking about the pain, the suffering, the anxiety, the exhaustion. A truly complete economic picture has to at least try to account for this very human side of being sick. And this all comes together in something called the ECHO model. It's basically a framework that reminds us to look at the whole picture. E is for economic outcomes, all those costs we just talked about. C is for clinical outcomes, the actual medical results. Did the treatment work? And H is for humanistic outcomes, the impact on a person's actual quality of life. So, we've pulled apart the medical bill and seen that the true cost of healthcare is complex, it's layered, and it's deeply, deeply human. Knowing how to calculate that cost is the absolute critical first step, but it also leaves us with an even bigger question, the one you see right here. Now that we know the cost, how in the world do we define the value? That's a question for all of us. Thanks for watching.